So I'd like to give you a very, very brief overview on the key findings of our Smart Health System study, which also features the Digital Health Index. Well, as Mr. Boni already has said, digital health has a big potential to improve healthcare delivery, to improve the prevention of diseases, to improve the exchange of information between doctors and patients, to help chronically ill manage their conditions. At the Bertelsmann Stiftung in our digital patient project, we've been looking at how digital health is being implemented in Germany for quite some time now. And what we found is that it is often patchy, it is unevenly distributed across sectors or regions. And one common phrase that you always hear in Germany during conferences is, well, Germany trails behind. But we really wanted to know, does it trail behind? And if it does, how much does it trail behind? So we asked Empirica, and whose Mr. Thiele is also present today, to make a comparison and to develop an index of how countries can be compared in managing digital health implementation. And what we did is we included countries of different sizes, because one of the arguments you hear is always that smaller countries have it easier than larger countries. We included federal states and centrally governed states. We also included different health systems, so social insurance systems and NHS systems, to have a comparison if we can, to see if we can find any patterns. So I brought you some slides, and to see the ranking, you can see on the first slide that how countries fare on our digital health index. And the first and foremost result is that there is no clear pattern between systems. In as such, there are larger states like Canada with a federal healthcare system being rather on top. There are smaller states, of course, being on top, but also smaller states being more down on the list. And well, for us, which was the most important result, of course, from a German perspective, was, well, Germany does trail behind, coming out in the one of the last places. As you can see from the graph, there are 3 dimensions, more than 30 indicators, being broken down in 3 sub-indices, looking at policy activity. So is there legislation in place? Do countries have a strategy? Do they dedicate budgets? Digital health readiness. Do you have infrastructure? Are there standards in place? Basically, or to make it short, are there the preconditions to implement digital health? And in the end, finally, what is the actual data use? So is there a data exchange between hospitals, between doctors? Are there patient portals in place? And so on and so on. Those 3 indicators then, or sub-indices, put together form the final score. And well, after we had answered the first question, well, Germany does trail behind, one must say that no country is perfect. In the sense that certain countries are advanced, but for example, but sometimes they still have certain problems in sub-areas, for example, that standard setting is not implemented completely, for example. But it would be now too long to go to dive into each and every country. Yet, another thing which is important to say here is that now you could say, well, countries having a strategy or having policy activity does not automatically mean that this will lead to actual data use. Because, you know, you might have a nice idea, but implementing it is another question. What we could find is, though, that we have a correlation between a country having a huge policy activity usually correlates also with high implementation degrees. Countries which have a strategy also end up implementing digital health better than the others. And going to the next slide where you can see those maps, just to underscore again the importance of strategies and institutions, you can see that at least nearly all countries which we have surveyed have at least strategic elements present. Yet this map does not automatically show the quality, of course, of our strategies. If you just compare Germany and Denmark, you would see that Germany has maybe some laws with strategic elements how to tackle digital health scattered in various laws, which do not form a coherent strategy and not a coherent aim. Whereas, for example, Denmark already has a third or fourth comprehensive digital strategy how to digitalize the Danish healthcare system. A second thing about strategies is that you need someone who implements it and who, accompanies the implementation. And this is in most countries done by a dedicated institution. You might call it an agency, you might call it a knowledge center, whatever it is. 15 out of 70 countries surveyed do have a dedicated institution, mostly as a sub-institution of a health ministry. The competencies vary across countries a lot. Some agencies are only dedicated to standard setting, semantic or technical standards. Other institutions like the Canada Health Infoway would also provide information for doctors and patients and start information campaigns for the general public. So you need some institution that helps. In France, for example, the ASIP Santé will also provide guidance guidance and some counseling for local authorities how to implement digital health at the regional level. So those things considered, we do consider them to be crucial. So to go on to the overarching argument that we would draw from this study, it's a 400-page study which I won't dig into each and every detail in each and every country, is this what we call the trio of success factors, what we call political leadership, digital health institution, and a strategy. So by political leadership, we mean that national politics, in order to be successful for digital health, need to define what kind of health policy goal do we want to reach with digital health. Do we want to improve access to digital to healthcare? Do we want to improve access in rural areas? Do we want to help chronically ill patients to better manage their conditions? Do we want to increase efficiency? All those aims are not mutually exclusive, but they need to be defined at national level. And political leadership also means to help stakeholders to share the same vision about where you want to go. A typical German phenomenon would be that the interests between payers and providers would be different, and they need to share a same vision about where they want to go with digital health. Second thing, as I already mentioned, is a digital health institution, which helps implementing digital health, setting the standards, providing the guidance, providing the information, and something which binds those things together would be then a strategy. And that strategy should be more than a mere document. So it should be benefit-oriented, as I already said. What kind of goals do you actually want to reach with digital health? Should it make doctors' life easier when they work? Should it help a patient manage their condition, and so on? It should be a step-by-step implementation, meaning that very large projects, if you try to implement a very large infrastructure, can have big problems because you get in the implementation, you can run into troubles. So if you define clear, for example, treatment patterns or patient groups, it's easier to do. Third, then promote the public acceptance, because digital health is technically complicated and sometimes it's not self-evident to patients what is the benefit. They need to be told what happens to my data. What is the benefit? How do I manage my digital application? How do I integrate it into my everyday life? Also, doctors need to know, what does it help? What, like you might get a new technical fancy device. You need to know how to integrate it into your work life. And then what is very important to us is the integration of end users. For example, what we consider best practice is that you can find in Denmark focus groups where people are actually asked what they expect from digital health, what they want it to be in medical healthcare delivery. And this is then integrated into the national strategy. So this would be a big point for us, not to just simply have a top-down process of we just digitize our healthcare system, because digital health is in itself is not an end in itself. It is it needs to follow health policy goals and actually make lives better. And just now to conclude, I'd just like to draw your attention to this last slide where I have given you an overview. I won't be reading any of this, but you can dig into our top performing countries of a digital health index and see how they tackle digital health policy in different ways. Some have been starting with e-prescriptions and then digging further into electronic health records. Others have put more emphasis on information. Just this as an overview for reading maybe at a later point. I've been also distributing here some summaries of the study, and at the end of April we will be presenting the whole study. It takes some time to translate the whole thing into English. At the 25th of April we will be presenting the study here in Brussels in its complete splendor. And I'm happy if you'd like to come, just talk to me at the end of the session. Thank you very much.